Drop, good.
Oh
Woo!
my lord. Oh my god. Oh my
He's okay, he's laughing.
Wow. That was really loud.
That was a huge one.
Oh my god.
Good job, man.
Oh.
Whenever you're ready, I'll get you on your other side.
Oh.
That one went almost as well.
Oh my god. Oh.
There's a good one.
Oh.
That's a really good one. Okay. That's a happy looking dude there. Ali, good to see you again today. Thanks for coming in.
Great to meet you.
Ali is a prospective chiropractic student who was in shadowing the other week just to kind of get a better understanding of my own personal take on this profession, which you guys would know is that whole diversified technique. He's also got kind of some full spine, I'm not going to call them issues, but complaints that he's kind of looking to have addressed because he hasn't been treated by a chiropractor before, as far as I understand.
Oh.
But Ali, I'm going to let you kind of talk about it a little bit. Why don't you go ahead?
Yeah, so this is basically my first chiropractic opportunity and my first treatment in a way. I'm a very active person. I'm an athlete. I have like this wear and tear kind of thing going on with my right traps, and it goes all the way down to my low back. So in the mornings frequently is flare-ups, and then after that I do a little bit of stretching, and slowly goes on along the day. But yeah, it's always like evident in my right trap, like bilateral traps, let's say. And
So
like,
both traps or just
both.
the right one? Okay, but
both traps,
more
but
so the
more,
right.
yeah.
Okay. Are you
More-
right-handed as well?
Yes, I'm
Okay,
right-handed.
Okay.
And on my low back as well.
Okay.
I've had a ACL reconstruction, let's say 4 years ago,
Okay.
on my right ACL with the medial meniscus also injury.
How's that knee feeling for you these days?
So the knee is feeling a little like on and off because I'm very active. So some days it bothers me, some days it's okay. But generally I've just lived to just literally go on through the pain and not just think twice, you know, because all athletes wanna, we can't just rest. We have to.
Ain't that the truth?
Yeah. So yeah, I'm very excited to be here.
All right. Well, happy to have you. Okay, so a couple of questions about that. You were talking about the upper traps, and then you went down to also talk about like your lower back. Where are you referring to in your lower back exactly?
So my lower back, my lumbar,
Okay.
let's say lumbar
Alright.
spine, spinal extensor kind of area. It's just more of spasms, like muscle spasms.
You said those are worse in the morning? Or?
Yeah,
Okay.
worse in the morning, definitely. And I feel like because I'm overcompensating to my left because my right knee is injured, then there's something going on there, you know.
What have you done so far for both the, you know, trap and back complaint and the knee? Like, have you been seeing a physio? Have you been seeing a massage? Like, how have you been managing or rehabbing through it?
I've been, because I work in a clinic, I've been kind of taking my own 2 cents on it. So I've been doing some like, let's say, just massage gun for myself, a little stretching, and yeah, like maybe morning yoga,
Okay,
but
fair.
not physio or anything.
So you haven't been doing anything formal, like seeing a professional?
Not
for it,
formal. This is my first.
Okay, so I mean, Ali reminds me actually quite a bit of myself when I was truthfully, way back when I was like 15. I used to be a competitive swimmer. Tore both my shoulders. Was a biceps tendinopathy on one and a supraspinatus tear on the other. And like, I mean, I had seen physiotherapists, I had seen chiropractors, and my MD. None of them really helped me. They didn't really give me much insight. A couple of them would throw me on machines. They'd show me some basic stretches. But to rehab and build back stronger and better, that was something that 15-year-old Adam had to figure out himself. So, I mean, it seems like Ali's been trying to manage that. Not sure why you haven't at least tried, especially if you work at a clinic, why you didn't try approaching them. Maybe that's something you can do. But we can talk about it today too, no problem. All the same, I'm happy to seem like you kind of managed to recover from the surgery, right? And I know you say you're compensating more on your left.
Yeah.
Of course, that's going to come with some compensatory changes up and down the chain as well. But overall, you still seem like you're doing okay. At least this is before the examination, right? Okay, so today we will take a look at the full back. We'll also do a knee examination. Anything else that you want to talk about, or is that's not like your cue to you need to talk more? But like, if there is more, then
Honestly, it's just multiple sides kind of thing, but mostly more evident in my right trap.
Like this is your main complaint.
Yeah,
right?
yeah.
Okay.
But also because of overcompensating on my left kind of area, my left hip started to bother me a little bit.
All right, so the left hip / low back region, and then the right trap. Those are your primary.
Those are my
Okay, got it. Glad we clarified that. That's good. So what we're going to do today then is we'll do a physical exam. Okay, and then we'll find the ways that should hopefully be able to provide you the most relief. All right.
Absolutely.
Good. All right, so let's get started with a very regular, unusual C-spine range of motion exam. Again, Ali was saying he was having more tightness on that right trap. So let's get you to start by bringing your chin down to your chest for us. Good. Are you getting any of that pulling sensation, any tightness here, just with that?
Yeah.
Yeah? Okay, now if I push down further, is that better, worse, or the same?
It's worse.
Worse. Okay, come back up. I want you to look up towards the ceiling now for me. How's that movement?
That's okay.
That's okay. And come back. And if I pull further, that's still okay?
Yeah.
Okay, face forward. I need you to rotate as far as you can to the left, please. We've got about, sorry, we can just bring this up. Good. Now as far as you can to the left. We've got about 55 maybe? Now as far as you can to the right, please. So we got 45. We've got about a 10-degree decrease on right rotation as compared to the left. Do you get pain on that, or what does that feel like when you rotate to the right, or no pain? You do? Okay.
It's pain.
And where do you feel that exactly?
I feel it right over here.
All right, so he's pointing, and again, you guys can't see this on camera, but he's pointing to that insertion point of the levator scapulae muscle, which we're very familiar with on this channel. I'll put a diagram up there so you guys can see if you're new. I'll get you to tilt your left ear to your left shoulder for me. Okay, so we can get to about maybe 30 degrees, 25 degrees, right ear to right shoulder. We can actually get a lot farther to the right side than we can to the left with this one, with 45 degrees versus that aforementioned 25. Any discomfort on either of those movements there?
More tightness when I'm looking to the left.
And that tightness is on this side? You feel it pulling?
Or it decreases.
Okay, got it. Hey, give yourself a really tight hug. And I'm going to get you to rotate as far as you can to the left, please. As far as you can. Any kind of pulling throughout the thoracic spine here with this, or no?
A little bit.
A little bit? Okay, we can get to about 55, 60 degrees. Now as far as you can to the right, please. Okay, we're about symmetrical on the thoracic rotation, so that's good. All right, stand up for me if you please.
Yep.
And please try to bend down, touch your toes for me as far as you can. Do you get any of that pulling or pain kind of in the low back as you were talking about? I think you said it was left side, yeah?
Yeah, a little.
It's actually really interesting because just feeling his lumbar paraspinals this position, left side feels like a rock as compared to the right. The right's pretty stiff too, but wow. All right, come back up for me.
Yeah.
I want you to extend backwards now for me. Any discomfort in that movement?
Oh, yeah.
It's worse on bending back. And where are you feeling that on bending back?
Kind of like right here.
So a little bit higher than the low back proper. So he's pointing kind of to the upper lumbar region, not quite into that TL junction we're super familiar with, but we'll examine with palpation and see exactly where he's talking about. You can have a seat for me once again. Perfect. He was also saying that he's getting, yes, that lumbar paraspinal tightness, so we're going to be looking at that. Yeah. But that was it the right knee that you said?
My right knee.
Your right knee. Okay, so we'll do a right knee examination too, as well as the hip and the ankle. Why? Because anytime we get extra stresses put through the knee, my mind always goes to hip or ankle first, even in the cases of post-trauma to the region. But all the same, let's just start with this side with the basic straight leg raise. We're going to take this, and we're just going to lift this straight up. Let me know if you get any low back discomfort or pain with this, or any zigging down the leg.
No, it's all good.
All right, slowly lower this down now, please. Yourself. That's okay?
Yeah.
Good. All right, and we're going to do the same deal on this side. We're going to lift this straight up. Any discomfort in the low back with that?
Okay. Hamstrings and not low back, just hamstrings.
So just tightness of the hamstrings.
Way more tight than low.
Okay, and this is notably the side that has the post-surgical recovery on the knee, and we're getting more tightness in the hamstrings on this side as compared to this. Yeah. That's also made evident by the fact that me pushing on this leg here, I can't get it any further. Okay, we're capped at about, I'd say, what is that, 65, maybe 70 degrees, whereas the other one we were able to get up to about 80. So 80 is within the normal limits of this, but we are definitely decreased by hamstring tightness on that right side. All right, I will bring this up, bend the knee. You okay with that bent knee? Perfect. gonna push on through. Is that okay?
Yeah,
Little hip kind of impingement feeling there. Okay. Let's do a hip range of motion. Bring this up. Internal rotation of the left hip, we can get to 45. That's very impressive. External rotation, let's take a little look-see. Oh, we just had a hip pop there, didn't we?
Two.
Okay. I wish I wasn't talking. That's like the third time that that's happened and I've been talking. Okay, well, 2 on that side. Let's see if they happen on this side too. And in this case, I will shut up this time. Yeah. Internal rotation is 45. That's good. Now let's see external rotation. Hey, Allie, stop talking. No, nothing on that side. But what do you feel?
So tight, right?
You feel really tight kind of in the groin adductor region, eh?
Really tight.
Okay. So it makes sense that given the history of surgery with this knee, that all the other muscles are super used to being engaged, hold everything stable, because obviously the feeling of instability in a post-surgical knee is not one the body wholly welcomes, okay? So what kind of stretches are you currently doing for this knee, or for this leg, excuse me, if any?
Stretches?
Mobility work primarily.
I usually foam roll.
Okay.
Glutes, hamstring, quads. I do a little bit of dynamic warm up, and just the regular stretches, to be honest, for the hamstrings.
Okay. Anything for the adductors? Because, like, as we can see, just in doing this external rotation, that adductor groin group is very much unhappy with you, right? Yeah. So, any thoughts as to what you could include there, Mr. Physio Assistant?
Oh yeah, 100%.
Good. We'll talk about those later, okay? And then, what's this? I'll take this. We'll do the thigh thrust on this side. Any discomfort in through there? Not particularly? No? Okay. All right, so Ali was mentioning that he's got a lot of soreness, like, yes, in the upper right trap, but also a lot of tightness in the lower left lumbar region. Now, I literally felt briefly through this region already just when he was doing that forward lumbar flexion, and yeah, it felt like an absolute rock compared to the right side. And even here, just laying down, I can notice a difference in muscle tone. Are you okay if I just lift this up to visually? Okay. I don't actually see any difference between the two sides, but like it's noticeable between the two from a tension perspective. And I wish you guys could see that. Obviously you can't, but it's all good still. So we'll go ahead and feel through the SI joints. And we'll climb up the chain here. Okay. Ooh. Yeah. Okay, so you're even getting that kind of tightness up, all the way up.
Yep.
Both sides. Did you get a haircut yesterday, man? Looks fresh.
Thank you.
Okay. Then you're also mentioning up into this right trap prop.
Yeah.
That right there, eh? Okay.
That hurts.
One of my favorite things with being a chiropractor is when a patient goes, "Oh, that spot hurts."
Yeah.
One of my favorite things is just poking it more. That's what trigger point therapy is, guys. I'm not being an ass. That's literally what we do to manage it. Okay. So, yeah, we've got quite a bit of tension kind of through the left side, paraspinals, lumbar, all the way up into the thoracic. Then we got some up here too, but we're also quite tender up in the right trap proper, the muscle belly. So we'll adjust in through the T-spine, focusing a little bit more pressure onto the left side. And then we can also, of course, do some massage-based work up here. We haven't felt his neck yet. We'll do that in a bit, but... And of course, we're going to be adjusting that low back too. But for now, since he's in the position for T-spine. All right, so the first time you ever adjust someone, Ali, there's no way to know how much force is needed.
Yeah.
Okay. I think you've heard me say this already in shadowing, but sometimes like I'll have like a 300-pound guy on the table who I could basically just sneeze on and they'd go.
Yep.
And then, 100-pound ballerina who I have to body slam to get them to release. So we're going to start light with you. Okay, and then gradually add more force if it is needed, if we're able to get anything at all. So let's see, okay? So first things first, gonna get you to take a big breath in for me, and all the way out fast, good. No, okay, again, in, all the way out, good. There's a little one. But yeah, okay, damn, we are very, very tight up in here.
Yeah.
Breath in, all the way out, all the way out. Sink, sink, sink. Good. That was a good one, huh?
Oh my god.
Yeah. Well done. And we're gonna do that, or we're gonna try that on this side now, okay? Here's gonna do this mic over here. Good, good. In. Sorry, in. And fast all the way out. Good. Yeah, there's a little one hiding there. All right, so you're almost in the right position here. I'm going to actually take this and pull so the shoulder's not super crowded. And you can put your head back so that it's not about to fall off the table. Good. Bottom leg straight. Top one's going to be bent. Good. And from this position, what I need from you is to, first off, let's actually kind of right there. Big breath in. All the way out. Sink into table. Drop, drop, drop. Good.
Oh my lord. Oh my god. Oh my
He's okay. He's laughing.
Wow. That was really loud.
That was a huge one.
Oh my god.
Good job, man. Whenever you're ready, I'll get you on your other side.
That was amazing, man.
It sounded like you needed that, yeah.
I really needed that.
All right, so again, almost in the right position here. We're gonna go ahead and pull that, get the shoulder not so crowded. Boom, you can hold right there. Bottom leg straight, top one bent, nice. Scooch the hips a wee bit closer, please. Thank you, good. And from this position, yep, you're all good. We're gonna get you to take a big breath in and all the way out. Sink, 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 good.
Oh,
That one went almost as well.
oh my god.
First time Chiro, eh? Damn.
Oh my god, let's go.
So as Ali was saying, he's tighter on the, or gets more pain, excuse me, on the right trap as compared to the left. We're still going to be examining both sides of the neck. Remember that the upper traps, they are here, but they connect all the way up into the base of our skull up here. So it's good form to feel through the whole region. So starting with the right. So you don't actually feel that bad, but as we get lower down, I'm feeling more and more, and that is where we get more and more bulk of the trap muscles. That kind of makes sense to me. Okay, ow, he says at the very top. So maybe my fingers are failing me on this Sunday morning, but if we're tender throughout the right side, we can absolutely work through that region. So you've never had your neck adjusted before, right? No? Okay.
Only self-adjusted.
Only, right. So at least you have that level of experience, right? So what I need from you, yeah, we're just going to turn as far as we can to the left and then drop into this hand here. Okay, now from this position, I want you to just relax as much as you can. And good. There's a little one right there. And I think my shoulder bumps the camera, but all good. That's a happy looking dude there.
Oh yeah.
Okay, good.
Wow. That was crazy.
You liked that, huh?
Oh yeah.
Glad you think so. Not as big as a release as I thought we were going to get, but all the same, we're going to turn as far as we can to the right. I'm going to be going for this upper segment here this time, okay? We're going to do that.
Oh.
There's a good one. That's a really good one. Okay.
Oh my god.
And now we're going to try for the left side proper. So same positioning for you, but different hand and thrust orientation for me. There we go.
Wow. Oh my god.
All right, we got quite a bit out of there. So a quick note on self-adjusters. It's near impossible to get the base of the neck and the very top of the neck in self-adjusting. When you self-adjust your neck, it's easy to get everything few in between. But the issue with that is if we're increasing the range of motion throughout one region, but we're not restoring that within the full region, that's going to lead to increased feelings of tightness in the regions that don't get that same increase, right? So that is why I'm lucky enough to have job security.
Yeah, that's awesome.
All right, so in feeling through Ali's back, we found that he was quite hypertonic in through this left side here and tender on the right upper trap. So what we're going to do is one of our favorite things to do on this channel is the instrument-assisted soft tissue therapy or the sports massage. So once again, we like to do this a lot. Why? Because it works on the fascia that sits on top of all of our muscles, helps those structures to slide against one another without creating friction. We get adhesion to the fascia. We can get repeated stiffnesses of the whole region. So we address that with this because not many therapists will address that kind of structure, and we're looking at positive prognoses, hopefully, right? All right, so at this point in time of the video, I usually like to try to ask the patient a question about themselves so that they can talk a little bit more and give the audience a chance to connect with them. So, Ali, my question for you today is to tell us something that you find rewarding about your job.
All right. So first and foremost, I'm a physio / chiro assistant at a clinic in Mississauga. One of the things that I feel very rewarding is to see how the patients progress and return to their daily living life, and that's very rewarding for me. And that's also part of actually most of the reason why I want to be a chiropractor in the future. So honestly, when let's say a patient comes in, like he's very limited in terms of his gait, his walking, and because he has low back spasm. So I follow the treatment protocols by the supervisors, and with their supervision, obviously, assist them on the stretching exercise. Obviously, first couple phase is like pain-free, pain management kind of phase. After the pain subsides, we do a little bit more strengthening work of the hips, of the glutes, and of the core, just to kind of strengthen the lower chain. And yeah, so after that, I love when they say, okay, well, after this session, they felt really good. That actually makes me. That's the reason that makes me get up in the morning and actually work, right? So I love that part of my job.
100%, man. Like, I obviously understand that exactly.
Yeah.
Like when patients are feeling better and they've been struggling with complaints for a while, not really able to get better. Anybody else they've seen, other chiros, other physios, other docs. It is a very rewarding feeling, feeling like you're making a difference and taking away someone's pain.
Exactly.
It's nothing's quite like it. So,
absolutely.
good on you.
Yeah, that's why I want to follow in your steps and be a chiropractor one day. So.
Give it some years and you will be yet. Okay.
Oh, yeah.
Yeah. Okay.
And I also really enjoy playing sports.
That ties in nicely too.
Oh yeah, that's tight. Whoa.
Alright, so back at the start of this video, Ali was talking about getting most of his pain down from that levator scapulae insertion point as well as the traps proper. So of course, we're going to do some MRT because that's like my favorite thing to do for the upper traps and left scap. There are other ways to handle it, but this is my preferred way. Not necessarily my patient's preferred way, but I still enjoy doing it. So we're going to actually, that's still, whew, okay, I'm glad we're doing this. I think you should look up and to the right, please. Good. I'm going to take a pointy elbow. I'm going to put it right there. I need you to slowly look down to the left, okay? Good. Up to right, down to left. Yeah, my patients don't like this, but they do like the after effects as a general rule of thumb. Whoa. Right. Up to right, down to left.
Ow.
Flatter me. Up and to the right. Woo. Down to the left. And up to right. Down to left. Good stuff. Face forward. Please tilt your right ear to your right shoulder. And left to left. Good. Right to right. Left to left. Good. Right to right. Left to left. Good. Right to right. Left to left. Good stuff. Okay, just do me a favor, just while you're sitting like this, can you rotate your head as far as you can to the right, please? Okay, so if you can recall from the start of the video, Ali was only able to get about 45 degrees to that right rotation. One more time, just show the camera once again. So a little harder to see from that angle, but now we're getting to at least like 75. So that's a 30-degree increase in C-spine rotation just after a treatment session. Now, one thing worth noting is that a big area of restriction was in that upper right atlas axis suboccipital region. The C-spine, different regions of it are responsible for the different, we'll call them percentages of movement. The bulk of our rotational ability comes from that very top region, okay? So it makes sense in that after releasing that right upper C-spine region, we restore a lot of that lost rotational direction on that side, okay? So that's why we're able to see such a dramatic before and after in this case. If we're more consistent about it, and if we can find out some sort of treatment plan with the intention of being as infrequent as possible, emphasis on infrequent, we should find ways to be able to get him to restore that range of motion and keep it as long as he can between sessions, okay? So I just wanted to highlight that for you guys at home. I want to highlight that for him too. Yep. Upper region of the C-spine, that's where most of our rotation comes from. If you're having trouble rotating your head, it's probably from up there. If you're having trouble laterally flexing your head, it's probably from lower down, okay? Now let's go ahead and do the other trap as well, just to be thorough. I'll get you to look up and to the left, good, and slowly down and to the right, go ahead. Sorry, we're gonna go from up here. Oh. To down there, okay? People get this wrong all the time, no worries. Up to the left and slowly down to the right. Oh my God. Up to left, slowly down to right. 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 You'll find no mercy here, buddy. Good. Face forward. Tilt your left ear to your left shoulder.
Left ear.
Good. And right ear to right shoulder.
Oh my.
Low. Left to left. You might be well suited booking in for a proper massage, my dude. Right to right.
Yeah, I need that.
Yeah. Left to left. Right to right. Oof.
Yeah.
And left to left.
I felt that now.
Right to right. Yeah. All right. Good stuff. Stay where you are for a moment.
Yeah.
Ali, how did you find all of that?
Wow, that was actually mind blowing.
Good.
Like it's crazy to
think
find
that.
that distinction from like watching your videos and always just watching chiropractic videos, and to actually being adjusted for the first time, especially on the lumbar adjustment.
Yeah, that
facing the walls just like exploded. That felt really relieving. The neck too, because I told you about like I self-adjust at home my neck, but I did not notice that there is literally like
the areas that you can't get quite
and,
simply,
and I can like literally feel that, right? So that distinction is really just, it's mind blowing. Thank you so much.
Hey, no worries, man.
It's amazing. Loved it.
So as Ali said, like he is a self-adjuster, and there's nothing inherently wrong with that. But for comparison's point, like how well can you massage yourself, right? You can massage like your whole body, but there are regions on your back that you simply can't reach, right? It's a similar comparison point when we're talking about self-adjusting. Like, yeah, okay, you can adjust some of it, but there are regions that you just won't be able to reach, right? And if you want to get those addressed, you need some external force, which is best done by, another person, in this case a chiropractor, right? Do you have any other questions about anything we did today, or anything else you want to talk about? Thoughts, concerns?
No, not really. I just this guy's amazing. Please do yourself a favor and literally just come here. It's mind blowing. It's fascinating.
I really appreciate Ali. He's a regular viewer of the channel now, so thank you so much for saying that. I appreciate it. Well, we'll talk a little bit more about what you can do to self-manage stuff off screen here, and then we'll keep in touch with the whole application and whatnot. All right. So thanks for coming in. I appreciate it, Ali. Take care.
Thank you. Don't forget to like, comment, and subscribe.
Thank you, Ali.